Welcome to Health Psychology 508, and we will be looking into Unit 2, covering on health behavior and primary prevention. For Unit 2, let's get into it first. We will look into some of these in this chapter: an introduction to health behavior, health promotion and overview of it, changing health habits, cognitive behavioral approaches to health behavior, change, and the trans-theoretical model of behavior change, changing health behaviors through social engineering, and venues of health habit modification. Now, if you look at this table, you can see that in terms of the leading causes of death globally, heart highest and as you can see, this is the WHO findings for the difference from 2000 to 2019, the most recent. And of course, the heart disease seems to be the highest, followed by stroke and other respiratory as well as pulmonary diseases, followed by diabetes and kidney disease on the 9th and 10th ranking. Now, if you look at all these diseases, risk factors that is involved in all of these diseases include, for example, heart disease, tobacco, high cholesterol, high blood pressure, for cancer, smoking, unhealthy diets. These are among the risk factors for leading causes of death globally. And what is important to look into, as mentioned here, we want to focus more into looking at health promotion, prevention and promotion. So in the area of health psychology, the focus is mainly on health maintenance, health promotion, and health prevention. So let's look into health promotion. It is mainly to have a good health and wellness, including having personal and collective achievement in terms of obtaining a good health, overall health. And health behaviors are part that will be looked into in health promotion. Now, if you look at what health behaviors is, it is basically steps taken by people to enhance or maintain their health. And health habits is basically firmly established and performed habits that are automatic without awareness of individuals. Primary prevention. It is basically taking measures to combat risk factors for illness before it has a chance to further develop. Now, some of the strategies are getting people to alter their problematic health behaviors, keeping people from developing poor health habits in the very first place. Factors responsible for practicing and changing health behavior. Now, demographic factors such as, for example, age, gender, characteristics, all these can be some of the factors that is responsible in whether individuals will practice or not practice health behaviors. Value system, an individual's value system, whether they believe in improving health, in maintenance of good health, or even personal control. So for personal control, there is a scale called Health Locus of Control scale, which measures the degree to which people perceive their health to be under personal control or not. And these are important measures to look into when it comes to practicing and maintaining health behaviors. Also, some other factors such as social influences, where in social settings and social environments, practicing health behavior can be difficult if it is influenced by other members within the society, friends, family, even practicing, for example, a healthy eating behavior starts from the family upbringing as well. So these actually are also important factors when we intend to look into practicing and changing health behaviors. Perceived symptoms, not some, they don't feel that they need to take any further actions, and they don't think that they're susceptible to certain disease, then the possibility of taking measures to practice health behaviors may not be as prevalent. And the personal goals and values as well of individuals are important when we want to look into healthy behaviors or health behaviors. Also, access to healthcare system, delivery system. For some people, especially those from the marginalized groups or lower socioeconomic statuses, it is challenging and difficult for them to access healthcare, especially, for example, in kampong areas, in villages in Malaysia. The access towards healthcare will probably be only when, even though there is these One Malaysia clinics, for example, but the access to these healthcare would only, for example, screening, checking of yearly screening, all these, there is certain particular programs that the Kementerian Kesihatan Malaysia does, reaching out to these groups of population of people from the lower income, is only when they get exposed to such screenings. Otherwise, it becomes very hard for them, or even the concept of the idea that they would need to undergo annual checkup, health checkup, for example, there would be a feeling that it is not necessary. So even knowledge and intelligence of people. So if people are unaware that certain practices can actually result in certain unhealthy, how do you say, conditions, unhealthy or some form of disease or illnesses. So without such knowledge or awareness, that could also be among the factors in whether individuals will practice or want to change their health behaviors. Now, barriers to modifying poor health behaviors. Emotional factors can be one of the barriers as well, because there is something called emotional eating, for example. When individual is undergoing stress, yeah, they might indulge in unhealthy eating behaviors. So these are some of the emotional factors that can lead to unhealthy behaviors, or even of substances during distressed emotion, or the person is experiencing stress, they may indulge in unhealthy behaviors such as consuming alcohol, excessively. Of the barriers, including instability of health behaviors. Yeah, so sometimes different factors control different health behaviors, and different factors may also control the same health behavior for different people. Other barriers to modifying poor health behaviors include history of the behavior, over the history of the behavior, or even across a person's lifetime. If they are unable to control behavior, perhaps when they started practicing a healthy diet at a young age, but unable or did not succeed, that could also lead towards the perception that they're unable to regulate or practice health behavior at a later age. So history of the behavior, or even across a person's lifetime, that can also be barriers to modifying poor health behavior. Yes. Now, looking into intervening with children and adolescents, it is always best to start young. And when we talk about intervening with these young age groups, individuals from the young age group, socialization are partially the factor as well. So influence of both parents, teachers, they become role models for children to practice health behaviors. So for example, a mealtime, in the family, if parents play a role model role in teaching children that, if the meal that they have on their plate is enough and sufficient, they do not need to add on if it's too much for them, what is right, what is not the right amount, or even, for example, eating certain type of food that can be healthy versus non-healthy, processed food. So all these are examples that can be set by parents or even teachers as role models. And teachable moments are also very important in family. So because these are the most important times for modifying health practices. And parents need to look for the windows of vulnerability, the time when the children or even for teachers, students who are first exposed to bad habits, they need to see when to intervene, when is the right time to intervene. So if it's taken precautions early, right, again, it's not confined to either childhood or adolescence. It's as long as at any point where there is a observation that there needs to be a time to intervene, especially when there are bad habits practices, that can actually have a better health impact, or even precautions can be taken earlier, and that can also reduce disease risk at a later age, or age after 45. Now, the biggest concern and questions that is there is how to intervene with people at risk, or at-risk people, how to intervene. Now, the benefits of intervening prior to obtaining any health conditions is that, of course, efficient use of health reduces expenditure in medications, for example, or even disease may be prevented altogether. It also makes it easier to identify other risk factors. But the that risks are not perceived correctly, or even testing for positive or risk factor may also lead to people being hypervigilant. Now, the ethical issues in intervening with people at risk, is choosing the right time to alert people. How do we know when do we intervene? Instilling risk reduction behaviors may cause psychological stress. There are no effective intervention that may be available for cases with genetic factors. What if obesity in an individual is due to genetic factors? Now, how does a health psychologist, for example, intervene in such situations? Emphasizing risks that are inherited can raise complicated issues, especially in family dynamics. The health promotion efforts that can be taken for older adults are to maintain healthy, balanced diet, as well as a good exercise regimen. Steps to reduce accidents, control alcohol consumption and eliminate smoking so that it doesn't increase higher chances of chronic illnesses. Reduce inappropriate use of prescription drugs if they are taking any prescription drugs. Again, to reduce inappropriate use of prescription drugs can also reduce accidents, for example, falling, because excessive taking of certain prescription drugs can cause some imbalances which can lead to falling, and these are accidents that can cause mortality as well. So also obtaining vaccinations against influenza. Many individuals believe that influenza vaccines are only for little children, but a lot of older adults are also prone to getting flu viruses, and this could lead to pneumonia and then death as well. So it is very important to have the knowledge as well as awareness of obtaining vaccinations against influenza for older adults. Also, to have them remain socially engaged in order to have social support as well. Now, ethnic and gender differences in health risk and habits. Health promotion should take the social norm of a group into account. Health practices in a community, for example, how is it being conducted? Some of the informal networks of communication and language. Are there co-occurring risk factors in ethnic groups? For example, the different lifestyle practices, the diets that are in different ethnic groups, their, for example, exercise regimen in different ethnic groups. So these are important to look into. Combined effects of low socioeconomic status and a biological predisposition to particular. There could be some ethnic groups that are more prone or predisposed to a particular type of illnesses, and due to the low socioeconomic status, there is a higher chance of contracting or getting such illnesses. Change and health behavior. Now, when we look into how to approach change in attitude and health behavior, one of the factors that needs to be looked into is the educational appeals. Change the health habit if they have good information about their health. Now, awareness or even the idea of whether they're susceptible to that illness can result in whether they choose to change their health habits or not. Fear appeals. People change their behavior if they fear that a particular habit is hurting their health. However, excessive fear also can reduce chances of adherence. For example, we know that there are cigarette packagings that has been done in Malaysia using fear appeal, where they've put images of lung cancers on cigarette packets, but it has been shown in several studies that it is not effective because excessive fear as such may not they may not feel that they might be susceptible to it. It's someone else, not them, for example. The message framing is also important. It depends on the type of message that is being sent, whether it is fear-inducing or not fear-inducing. And also, even if it's fear-inducing, as mentioned earlier, an individual's own motivation actually plays a role as well. If they believe that they need to make the change, then the change could happen. But if not, it is not possible for change to occur. Main models and theories within health psychology that is being used to understand how to change health behaviors. Health belief model is one of them, and the health belief model focuses mainly on understanding what influences health behavior. Components are, for example, perceived health threat. If they feel that their behaviors actually lead to a particular health threat or disease. The second one is the perceived threat reduction. Do they believe that if I practice such a behavior, then would that threat reduce? It's used to increase perceived risk and perceived effectiveness of modifying or taking steps to modify health habits. However, this model leaves out self-efficacy. Understanding that whether one is able or has control over their own practice of a particular behavior. Now let's look at the theory of planned behavior, another model that's commonly used. Now, the theory of planned behavior focuses on uh, five main factors. First, the attitude towards specific action. Second, the subjective norm. Third, the perceived behavioral control. Now, if a person has a particular attitude towards specific action, if they have a positive attitude, for example, if an individual believes that the outcome of the behavior can improve or change their health, and also if there is a subjective norm where the family norm, for example, thinks that they should change their health habits, and if there is perceived behavioral control in which they believe that they can change their habits, that would lead to behavioral intention, that is intention to change their diet, for example, or intention to change any unhealthy behaviors such as smoking, for example. And that would lead then to the health behavior or adopting a healthier practice. Now, another theory that is commonly used is also the self-determination theory that looks into people's active motivation to pursue their goal. And the components that are fundamental to the behavior change are autonomous motivation, which is their autonomic motivation. It becomes automatic, yeah, or unconscious motivation, and the perceived competence, whether they think they can do it or not. So self-determination theory focuses mainly on individuals' motivation and actions. Theories in which believe that the intervention may not always provide the impetus to take action. So even if intervention is given, it may not necessarily push an individual to take an action. Assume that behavior changes are guided by conscious motivation. Now, what it's saying is that the attitude theory perhaps focuses on conscious motivation to do something, but there could be also unconscious motivation that is not looked into. And also it ignores the fact that behavior change occur or can occur automatically and are not subjective to individuals' awareness. Implementation intention is also another thing that should be considered. What it is that it integrates conscious processing with automatic behavioral enactment. That means consciously thinking about change and having a behavior that is automatic to that conscious thought. That means doing the action. And control of goal-directed responses can be delegated into situational cues. So, for example, to follow a healthy diet, particular situational can be given to implement their intention to change that behavior. Now, changes in intention also leads to changes in behavior. And whether there is a function of the brain, especially in processing of health behavior change. Health behavior change apparently has been found to be responsive to persuasive messages that can occur outside of awareness. That means if there is a persuasive messaging that is detected in some parts of our brain. So there are brain activations in the medial prefrontal cortex and the posterior cingulate cortex. When there is messages that makes sense to individual and they feel that there is a need to change, they go through this self-transcendence stage where they start affirming or having affirmation of compassion and realization to change, and this has been detected in the medial prefrontal cortex and the posterior cingulate cortex. So the health message then will link to these parts of the brain, and these parts of the brain will be activated, and that would then lead to behavior change or physical change in anything. So for example, exercise. So if They realize that they need to exercise, and they affirm that it is important to change. They have compassion to themselves, and then they receive these persuasive health messages that tell them the importance of exercising. That would lead to physical activity. The cognitive behavioral approaches to health, behavior change, there are a few methods that can be used. The cognitive behavioral therapy focuses on modification of target problem. So focusing on what can be done to target, to change that target behavior using some form of reinforcements and punishments. This includes self-monitoring as well, in which individuals can understand the dimensions of poor health habits before the change actually begins. So they monitor the change in their behavior. This could be done through, for example, journaling is another method in CBT that is being used for health behavior change. Frequency of a target behavior and its consequence is also part of the CBT processes. The stages are learning to discriminate the target behavior. So the difference between what is a healthy behavior and a non-healthy behavior, and charting the behavior, which is to identify the steps that they can take to reduce unhealthy target behaviors. So, for example, helping in identifying any discriminative stimuluses, any stimuluses that makes them want to indulge in an unhealthy behavior. So, for example, smoking, the discriminative stimulus could be even, for example, the cues. There's the smell of the cigarette smoke, and or even an individual smoking, observing somebody smoking. So these are stimuluses that can be identified and reduced to further reduce any unhealthy behavior. Classical conditioning has been also used before, which is a pairing of unconditioned reflex with new stimulus. So it all again depends on the willingness of the client for these behavioral approaches to be successful. So there was a study done on using classical conditioning with smoking cues. You can watch the details of it in the link provided. Operant conditioning was also used before, where pairing of voluntary behavior with systematic consequences, so a positive punishment or reinforcement, a negative punishment or reinforcement is being given to reduce the unhealthy behavior. Modeling is also a form of cognitive behavioral approach in which a person learns from witnessing another person performing that behavior. Stimulus control interventions are also among the cognitive behavioral approaches, in which, for example, ridding the environment of discriminative stimuli that can evoke the problem behavior, ridding the environment of discriminating stimuli that can evoke the behavior, a problem behavior, like I mentioned, the cues. So, for example, being exposed to a friend who is smoking, that can provide stimuli to the individual who want to smoke. Or even for some smokers, they tend to take on cigarettes after a meal. Now, if that is a discriminative stimuli, or that's a stimuli cue, stimulus control intervention will look into how to reduce chances of smoking while after consuming a meal, and creating new discriminative stimuli for a new response. Okay, so to reduce smoking after consuming a meal, what are the new discriminative stimuli that can be used to replace the old stimuli, for example? Self-control of behavior is also packed under behavioral approaches, and CBT emphasizes on self-control. So people learn to control the antecedent and consequences of the target behavior. Cognitive restructuring is training people to recognize and modify their internal monologues to promote health behavior change. So for example, if they believe that they cannot change, they believe that no matter what they do, they can't stop their unhealthy behavior, cognitive restructuring is to train individuals to have these internal monologues, to reframe their thoughts. Self-reinforcements, for example, providing or rewarding oneself to increase or decrease of behavior by having contingency contracting, for example. That is to have a contract to say that if they are able to complete the task of, for example, exercise within this period of time, then that will result in a reward. And if it's not, a self-punishment will be given if they have not successfully completed that behavior, for example. So that is called the purpose, that is the use of the purpose, that is the purpose of the contingency contracting. Now, behavioral assessments or assignments can be done at home. This is sort of like a take-home homework for individuals, and they need to monitor as well as what are the areas that needs improvement. So journaling or even some form of homework that is given. So these are called the behavioral assignments. The goal is for therapeutic intervention. Advantages of behavioral assignments. One of it is client becomes involved in the treatment process. So it's active process of change from the part of the client as well. Client produces useful analysis in planning further interventions. Client becomes committed to treatment process. Responsibility for behavior change is slowly shifted to the client, and homework assignments increase clients' sense of self-control. Social skills and relaxation training or assertive training are also important, in which people are trained in methods that help them deal effectively with social anxieties. Relaxation training such as deep breathing as well as progressive muscle relaxation can also help. Is also one of the cognitive behavioral methods. Interviewers adopt a non-judgmental, non-confrontational or encouraging and supportive style in providing treatment or intervention, expressing empathy, developing support and self-efficacy in clients, as well as the goal is to help clients express their positive or negative thoughts regarding their behavior. So this is some of the things that is being done in motivational interviewing. Relapse prevention is also important, in which the focus is on abstinence violation effect, which is feeling of loss of control that results from when a person has violated self-imposed rule. For example, if they are supposed to be exercising 3 times a week, but they have not done so. So this is basically that they have violated their self-imposed rules, and these abstinence violation effect is a feeling of loss of control because of that. Now, the reasons for relapse could be aiding, right? Being aware of why they need to stop the behavior fades, or even negative affect, which means negative emotions can also lead to relapse in individuals. These should be integrated into treatment programs to reduce relapse. To understand better on the relapse process, let's look at the cognitive behavioral model. Usually Usually, in a high-risk situation, individual would either opt for effective coping responses or ineffective coping responses. If they have chosen effective coping responses, that would increase their self-efficacy and decrease probability of relapse. However, if they choose ineffective or they have ineffective coping response, that would decrease their self-efficacy, and that would indirectly decrease their effects of expectancy of, for example, controlling alcohol behavior, right? And that would lead to lapse in the use of lapse in stopping the use of alcohol, right? So abstinence violation then occurs and increased probability of relapse. That means they continue to indulging into consuming alcohol behavior and excessive alcohol behavior. Techniques that can be used to help reduce relapse is asking people to identify the situations that may lead to relapse, engaging participants in constructive self-talk. So what is the reason that they have these negative emotions towards stopping the unhealthy behavior? So they need to, there must be some form of support of constructive self-talk. And usually therapists will provide this. Lifestyle rebalancing, promoting a healthy lifestyle and reducing the likelihood of relapse. So this is also some of the techniques that can be used in relapse prevention. Advantages of CBT. CBT is a carefully selected set of techniques that help deal with any aspect of problem. And a therapeutic plan usually is tailored to each individual based on their problems. And of course, it is usually assisted with people that have the skill to help modify these health habits using multimodal interventions, different form of interventions to reduce some of the unhealthy health habits. Now, let's move into another theory that is also commonly used to understand health behavior change, which is the trans-theoretical model of behavior change. This model analyzes the stages and processes people go through in bringing change in behavior. And for the trans-theoretical model, it is also known as the spiral model of change or stages of change by Prochaska in 1992. The stage starts with pre-contemplation. So for example, if we choose smoking behavior, pre-contemplation can occur as a result of a particular incident that has occurred. So for example, if an individual has some form of lung infection that caused them to be having severe pain, that would lead to realization that they need to change or stop their behavior. So pre-contemplation is the stage where they start contemplating or thinking about change, and then comes the contemplation, and then preparation, so the steps that they can do to stop smoking. So they can opt for some medications that can reduce or control or their smoking behavior, induce nausea when they smoke, or even nicotine patches. These are also preparations and action. Now, usually people will go through these pre-contemplation, contemplation, preparation, and action stage, and then they'll move into the maintenance stage. However, there are also chances for people to relapse, and this stage focuses mainly on the few points in lives of individuals that they will go through the pre-contemplation, contemplation, maintenance, and then hopefully as they continue that behavior, termination will occur in which they would stop these unhealthy behavior like. But there are also points in life where people experience relapse. So Let's look into how we can change health behaviors through social engineering. Social engineering here means modifying the environment in ways that can affect people's ability to practice a healthy behavior. So venues for health habit modification are usually in private therapist's office, health practitioner's office, or even, for example, in the family or self-help groups. But rather, why can't these changing health behaviors or social engineering be done on a larger scale in schools, for example, practicing or providing children, young children, with the knowledge and understanding of practicing good health habits, workplace interventions that can be provided as well, food, for example, healthy diets in schools, in canteens in schools, providing good balanced meals for children, community-based interventions that can be done as well, or even mass media, uh, through mass media, including internet as well. So these are some of the methods that changing health behaviors can be done through social engineering. Now we move into from health behaviors to health promoting behaviors. Look at exercise, accident prevention, cancer-related health behaviors, developing a healthy diet, sleep, rest, renewal, and savoring. These are some of the areas that we'll look into in Unit 2.2. Exercise is important in promoting health behaviors. It aids in maintaining good mental and physical health. When we talk about exercise, there are the aerobic exercise and anaerobic exercise. An aerobic exercise is marked by high intensity, long duration, and of course there is a need for endurance when it involves aerobic exercise. What benefits of regular exercise? Now here it is listed that it helps to control your weight, reduce risk to cardiovascular disease, reduce risk for type 2 diabetes, metabolic syndrome, reduces the risk for cancer, strengthens bones and HDL or good cholesterol, improves sleep, decrease resting heart rate, blood pressure, improves immune system functioning, and as you can see, overall, it does reduce any form of chronic illnesses or reduce chances of chronic illnesses. They usually come from families that practice exercise behaviors, have positive attitudes towards physical activity, have a strong sense of self-efficacy for exercising, energetic, extroverted, and sociable. That increases chance for them to actually go out and exercise, especially in, for example, in a social setting, in a park, in a gym, perceive themselves as athletic, social support from friends who want to exercise with them, enjoy their form of exercise, have a sense of responsibility for their health. Now, what are the characteristics that aid exercising? Convenience and easy exercise. So if an individual feels that they can go and perform or do exercise, which is convenient for them and suitable to be slotted in their lifestyle, then there is a high chance of them practicing or doing exercise. Less crowding, safe places, improve environmental options, or even social support, having a friend to do it together with, or developing a regular exercise program. So these are some of the characteristics that can actually aid exercising. Some other exercise interventions, such as family-based interventions, can be used, which is helping induce all family members to be more active. Relapse prevention techniques, such as increasing long-term adherence. So how to get the long-term adherence is usually by breaking down long-term goals into short-term goals. So for example, exercising, rather than saying that we want to continue this exercise regime for up to a month. So why not start just for a week to see within a week, and then continuously, in short-term periods rather than a long-term period. That could help increase long-term adherence. Interventions involving multiple health behaviors work, especially if it is with health habits that are linked to each other. They address these risk factors. Whatever interventions that involve different health behaviors can be also looked into. Now, home and workplace accidents are also common and needs to be looked at. The most common cause of death and disability among children is under the age of 5. So precautionary measures needs to be adopted. So how can precautionary measures be done? For example, installing safety catches, gates in their homes, placing poisons out of reach from children, teaching children safety skills, providing training and parenting classes to parents, especially in terms of what are the precautionary measures that can be taken at home to reduce chances of death or disability among children. And fall-related accidents are also common, especially in older adults. So some of the strategies can be to look into the dietary and medication interventions. As I've mentioned, some medications can cause dizziness, and that could also, if overdose of that could also increase dizziness, and older adults can have fall and slips. Physical activity to be given, better lighting, non-slip bath mats, shower grab bars to help them hold handrails in home. So these can be some of the strategies to reduce accidents among older adults at home, or even any fall prevention programs. Motorcycle and automobile accidents are one of the greatest cause of accidental deaths, and preventative measures that can be taken are, for example, social engineering solutions, like even laws in place for drunk driving, or even particular speed limits. So these are some of the social engineering solutions that can be taken. Psychological interventions also can be taken for preventative of accidental deaths, preparing individuals of the understanding of certain behaviors, for example, that can cause automobile accidents, not putting on their seat belts, things like that. So these are some of the interventions that can be given as well. Now, cancer-related health behaviors, for example, going for mammograms, that have been shown to have helped breast cancer mortality. And it is important for older and high-risk women to go for these mammograms, because the prevalence of breast cancer is quite high and common recently. It is also cost-effective cancer at a later stage, and it also improves chances of survival if detected early. Now, usage declines with age due to fear of radiation. So most older women, they tend to not want to go, for example, for mammograms. It could be also due to fear of the procedures. Embarrassment over the procedure, or even anticipated pain, anxiety of cancer, or even if it's detected that they have cancer, they may be fearful of that. Concern over the cost of how much it will be, lack of awareness that why it is important to go and conduct these screenings, or even the time or resource available for them. Sometimes in some places in rural areas, these are not available. For example, they have to go to a bigger hospital to get mammograms or get any sort of cancer-related health screenings. And so measures to promote screening is to change attitudes through providing some forms of intervention, as well as improving and also reaching out to populations that are hard to reach. Cancer is the second highest cause of cancerous death. So participation in screening is predicted by self-efficacy. So if a person feels that can go for the screening, they're efficacious, then there is a higher chance of them going for screening. Perceived benefits, if they feel that there is a benefit of going for these screenings, yeah. Physician recommendation, if it's recommended, detected and recommended by a physician, that is a higher chance, then they would go for screening. Social norms, where they are, there is increased awareness, yeah, the norms of their society or surrounding them, they are aware, and they encourage such screening. Of course, then that will increase participation, as well as some other barriers that could also, they feel that anxious, for example, to go through the procedures, they're unsure what it comprise of, what would be done. So that could also reduce chances of participation in screening for colorectal cancer. And what are the measures that can be used to promote screening? Community-based mass media programs can help, community-based education, interventions through social networking, recommendations from healthcare providers, as well as some reminder notices. So for example, there are some insurance companies that provide these reminder notices to promote people for going for screening. Some hospitals, especially private hospitals, have moved into this direction where they have these reminder notices that is sent out through WhatsApp messages to potential patients or patients who have, registered in the program, for example, in their program. So these reminder notices can help remind them that there is a screening coming up, and for them to go and participate in these safe science practices. Diet is also important because it definitely is controllable risk factor for many of the leading causes of death or chronic illnesses in the world. So dietary change is very important. It is especially critical for people at risk who have genetical predispositions, or those who are already diagnosed with chronic diseases, and that help as well. So, however, there are reasons for resistance of modifying diet because of the idea of restrictive, monotonous, or perhaps it's expensive. A lot of these diet meals, healthy meals, they cost a lot, and they are mainly the recipes. They come from the West, where some of the ingredients may not be available for the eastern side. So, or even it's hard to implement, it takes time, for example, to cook a healthy meal, and that's the idea that people have, which could lead to resistance to modifying diet. So that requires changes in shopping, meal planning, cooking methods, and eating habits. So recently there's a lot of available profiles on social medias like Instagram that promotes these healthy meals or diets, how to prepare healthy meals. So again, comfort food high in fat and sugars has to be reduced. Preferences for high fat food is there, which is why there is resistance, as well as poor dietary habits, because again, norm of the society, the upbringing of individuals may have, all these can actually lead to resistance to modifying diet. Controlling diet, now health diet requires strong sense of self-efficacy, as well as knowledge about dietary issues, including family support. That only can then help individual to manage their diet. Also, the perception that dietary change has health benefits has to be there. Adopting strong implementation intentions, family interventions, community interventions, these cost-effective interventions to see what are the cost-effective ways of preparing healthy meals. Telephone counseling can be done as well, and of course the social engineering that is done on a larger scale. Now we'll go into sleep, non-rapid eye movement sleep. These are the stages of sleep: stage 1, stage 2, 4. Now in all of these stages, disrupt can also lead to poor sleep cycle affected. Rapid eye movement sleep Why is it called rapid eye movement? Because of the eyes moving back and forth. As you can see, when a person moves into the rapid eye movement stage, the you can see the movement of the eye from the eyelid is quite rapid, and the breathing and heart rates become more harder, and the heart rate varies as well. Dreams then occur during this stage. This stage, it is marked by the beta wave, yeah, and as mentioned, it is for consolidating of memories and so on. So the sleep and health, it is if it's insufficient, it would affect the cognitive functioning, mood, job performance, or even quality of life and health. So the reasons of lack of sleep, it could be due to stress or high levels of hostility or arousal, or even when there is maladaptive coping strategies that is used when they experience stress, and then they use maladaptive coping strategies, worrying about the causes of stress or consuming alcohol. These could be some of the reasons of lack of sleep. For long hours, that could result in psychopathology, such as narcolepsy or any form of other sleep disorders. And rest, renewal, savoring is very important, because relaxation and renewal helps people savor the positive aspects of life. They reduce the stress, restores emotional imbalance. Also, it helps people to enjoy, have enjoyable activities. It lowers their blood pressure, cortisol level, which is a stress hormone, and also improves physical and cognitive function. Final bits are Unit 2.3, Health Compromising Behavior. Characteristics of health compromising behavior: obesity, eating disorders, alcoholism, problem drinking, and substance dependence, including smoking behavior. What are the characteristics of health compromising behaviors? Habitual and addictive. Windows of vulnerability in adolescence, that means it's acquired in adolescence. Influenced by peer pressure. Pleasurable and helps to cope with stress. Develop gradually. Have similar causative factors, common in lower social classes. Major cause of disability: it lowers drive to exercise, poor cognitive functioning, including difficulty performing some basic tasks, picking up objects. It's also associated with early mortality and can cause psychological, social, and emotional, economic stress. Obesity in childhood is quite common at present. The causes are due to genetic, sometimes even forceful feeding style or sedentary lifestyle, which is why children should not be forced fed when they're young, because this could lead to childhood obesity. Depends also on the number of size of the individual's fat cells. Socioeconomic status, culture, and obesity. There are also influences of social status and culture as well. Lower socioeconomic group has been found to have higher chances of obesity. Even depression can lead to that, or high neuroticism, extroversion, impulsivity, including if the norm of the society as well, that could lead to obesity. Now, dieting is a risk factor for obesity. There is something called yo-yo dieting, which is successive cycles of dieting and weight gain. So that means they diet, restrictive diet, and then weight gain, and then restricted diet and weight gain again. That's why it's called yo-yo, and like back and forth, right? And now, what happens with yo-yo dieting is that could actually lead to obesity from the lowering of metabolic rate. When such practices is done, there are chances of metabolic rate to get lower, and that could lead to theory of weight also is one of the risk factors. So individual has an ideal biological weight which cannot be modified, right? But if some practices of their meals are not healthy meals, so that can actually move the set point of their weight. Ways to treat obesity is through dieting, surgery. Surgery can also, once dieting, that when a person is able to practice good diet, that will reduce their weight, and the excessive flesh can be removed through surgery. Or even, for example, or even bariatric surgery is a form where the undergo a form of surgery that will alter their gut hormone levels. That is, they would have the restriction on their gastric bypass. Yeah, so the gastric bypass will be done, or a gastrectomy will be done, and this could also reduce chances of them for wanting to consume more food, for example. So that would help to reduce obesity. And then, of course, CBT, or cognitive behavioral therapy, can be done using screening, self-monitoring, or stimulus control, or even control eating, journaling on their diet, the food consumption. So these are some of the ways to treat. Now, the preventative measures is training parents about sensible meal planning, eating habits, changing lifestyle at a young age. If detected there is increase in weight, for example, school-based interventions, healthy meals in schools should be given in canteens and cafeterias, or even other social engineering strategies that can be taken. Eating disorders develop due to the idea of thinness, and this could lead to depression, anxiety, low self-esteem, and also even high disability or mortality rates. Amongst them are the anorexia nervosa, which is restricting diet or food, or self-starvation. These are causes. Anorexia can be done through therapy or even prevention. So therapy could include CBT as well as family therapy. Prevention through social norms, as well as getting individuals to have symptomatic acceptance to treatment. Form of eating disorder in which binge eating and purging occurs. That means they eat at a huge amount and then they start to purge or vomit out. Causes are listed here. How can bulimia be treated? Is by convincing people suffering from bulimia that it is a serious illness and disease that could cause death. So need to provide them with the knowledge and exposure or understanding or persuasive messages that can make them understand the result of their practices. Combination of medications or CBT, even using relapse prevention techniques, can help to treat bulimia. Alcoholism and problem drinking is associated to these following, and it leads to economic loss. Yeah, because when there is problem drinking, people tend to spend a lot in consumption of alcohol, buying alcohol, and it could also be social problems in which alcohol consumption, high alcohol consumption, could lead to certain violent behaviors, or even behaviors inappropriate that could also cause social problems as well. So substance dependence, when we describe on substance dependence, we need to look at understanding that it is physical dependence. That means the body adjusts to the substance and incorporates its use into normal functioning of the body tissue. That means it is sort of like a daily meal for individuals who are dependent on substance. They need to consume alcohol like they're consuming food, for example. So the tolerance here is another key factor in understanding substance, which is the body increasingly adapts to the use of substance. The tolerance becomes higher and higher. That means the more they need to consume more alcohol to feel the necessary high. Craving also is another key. which is strong desire to engage in behavior of consuming a substance. They crave, if there is a reduction of that substance, they would crave and want more of the substance because the tolerance has increased. Addiction is when the person becomes dependent entirely physically and psychologically after repeated use of over time. And withdrawal is also a result of this substance dependence, in which individuals will feel unpleasant. When they stop using the substance, they feel irritable, anxiety, intense craving for it, headaches, tremors, hallucinations. So these are indications of that individuals become dependent on substance. And some of the patterns of behaviors here, as listed here. Causes can be traced down up to the genetics or even social demographic factors in some areas, some environments or some regions or even some states, especially like in Malaysia, some states, some form of substances are norm in the society or in the specific state, for example, yeah, stress or financial alcoholism and problem drinking, low social support, unemployment, all these can lead to it. And treatments that can be done, CBT, modification programs, providing employment opportunities so that they would stop the behavior as they get involved in, the jobs, they get engaged in their jobs, they hopefully would reduce the consumption of alcohol, or even social support is very important. Treatment programs, getting into detoxification, especially for hardcore alcoholics, being supervised under monitored medical settings or rehabilitation centers. Also relapse prevention amongst the treatments. When looking into evaluation of alcohol treatment programs, it's important to look at factors associated with the successful alcohol treatment programs, whether is it because of the environmental factors, it's a controlled environment where they are given such particular treatment, or even the moderate length of participation, they're not forced to be there for too long, yeah, they get to then immerse back in the community, or involvement of family members and employers are also some of the factors that can lead to a successful alcohol treatment program. Social engineering is also important, an important approach for intervention efforts. Inducing adolescents to not drink or to keep that under control, some of the preventative approaches, promoting social influence programs in schools, also be amongst preventative approaches to alcohol driving. Smoking is also the greatest cause, and as mentioned, these are health compromising behaviors, usually acquired from co-workers or family members of smokers, and they tend to first begin as secondhand smoking and then continue to become a smoker. So effects of smoking, weight and smoking also can interact to increase mortality. It also can lead to depression and also relate to anxiety in adolescents. And what are the ways to reduce smoking? Changing attitudes towards smoking. Also, nicotine replacement therapy, as mentioned earlier, can also reduce some other interventions, social support, stress management, to reduce stress, because again, smoking can also be an unhealthy way of coping from stress. And ways to reduce also evaluation of interventions to see if are there any effective interventions that can be used for further enhancing reduction of smoking, brief interventions, workplace interventions as well, such as stop smoke, smoke-free areas. These are workplace interventions, and even commercial programs and self-help can also reduce smoking. Also should be implemented in schools. in which the emphasis of negative effects of smoking, or even conveying a positive image of non-smokers. Why is it good to be a non-smoker rather than being a smoker? Because image in mainly if you're smokers, then there is a macho connotation behind it. So peer groups are also used to foster non-smoking behaviors. That ends the Unit 2. Thank you, and we'll see you in